I have gotten this question a lot, like seriously a lot, and I decided to make a video on this. Like, Nurse Miss Mary, how do I know my partner has STI? And the men keep asking, like, what are the signs of sexually transmitted infection in men? So good day everyone, and welcome back to Nurses Lecture Room YouTube channel. My name is Miss Mary, popularly known as the Nurse with the Difference, and I make learning easy and accessible for all my viewers. Today, I'm going to be sharing with you 6 signs of sexually transmitted infection in men. 6 signs for you to take note of when it comes to sexually transmitted infection in men. And I'm also going to be sharing with you some examples of STIs. But before we go into details in today's class, if you are new on our YouTube channel, if this is your first time coming across our YouTube channel, and these are contents you are interested in, please click on that subscribe button, turn on that notification bell so you don't miss out. For all my returning subscribers, this is Nurse Miss Mary saying thank you. Let's go. Welcome back. Like I earlier said, today I'm going to be sharing with you 6 signs of sexually transmitted infection in men so that you get educated and stay informed as much as possible. For those that have not watched our video on how to prevent sexually transmitted infection, I'm going to be leaving the link in the description box below, or simply you can search on our YouTube channel and definitely you are going to find that video and other interesting content on our YouTube channel. We all know that sexually transmitted infection is an infection that is transmitted through sex. So that is the only way in which an individual can get STIs. So the 4 signs and symptoms I have for the men is a burning or inching around the penis. You know what a burning sensation is? If as a man, when you put on your boxers, you are sitting down, you're having this burning around the penis, that might be a sign of an STI. Or there's an inching, like any small thing, you are inching, you are dipping your hand, you are putting your hand inside your boxers to inch. Even while in public, you are trying to coordinate yourself. That might be a sign or a clue, or it is a sexually transmitted infection. Then the second one I have to share with you is a drip or discharge from the penis. If when you put on your boxers, you start noticing some discharges, you start noticing some stains around the boxers, like normally it wasn't there, all of a sudden you wear your boxers, you pull them down, you start seeing that discharges, and that's creating some abnormal smell on your boxer, and you know it's not urine. That might be a sign of a sexually transmitted infection that you have to look into. Then the third one I have to share with you is pain around the pelvic region. We all know what the pelvic region is. So when you are experiencing pain down there around your pelvis, that is a clue that this could be a sexually transmitted infection. Then the other one I have is sores. When you're having sores, bumps, redness around the penis, that might be a sign of sexually transmitted infection. Then the other one I have is burning during urination. You want to pee, you are feeling this burning sensation, like you are not holding it. You want to pee, you hold it. You want to pee, you hold it. So that is also a clue that there could be a sexually transmitted infection. And also you're also feeling pain when you want to pass fecal matter, when you want to poo, you are feeling pain. That might be a clue that you're having an STI. Then the other one I have to share with you, you're having to go to toilet frequently, like you're always going to the toilet to pee. Oh, I want to pee, you rush down. Oh, I want to pee, you rush down. Oh, I want to pee, you rush down. So that might be a clue that you're having a sexually transmitted infection. So these are the 6 obvious signs I have to share with you. Basically, most men, they are asymptomatic. Yes, most women tend to show signs and symptoms of STIs when compared to the men. So most men, they are asymptomatic, they don't show, but when they show, these are the signs that you are expected to see in them. And as a man, when you see these signs, it is better for you to visit your doctor as soon as possible, get the useful tests done, and get the useful medications for treatment. Don't just go about self-prescribing. Oh, I have an inching, I have a discharge, I think it's an infection. You go there and get antibiotics. No, abuse of antibiotics might cause future resistance to antibiotics. So as a man, if the symptoms becomes obvious, speak with your healthcare provider, speak with your doctor. And also, if your partner is treating an infection, is treating a sexually transmitted infection, even if you are not showing the signs and symptoms, it is advisable you treat too. It is advisable you treat. If your partner is treating an STI, it's possible you could have gotten it. So it's advisable that both parties treat and also avoid sex during that period of treatments. So these are the signs I have to share with you. Then I want to share with you all some common STIs that are sexually transmitted infection that are common that you need to know and you need to be aware of. We have chlamydia, we have gonorrhea, we have syphilis, we have genital herpes, we have AIDS, we have hepatitis B, we have genital warts, and we have trichomoniasis. Yeah, trichomoniasis. Am I pronouncing it with where? Yes, just know that it's a sexually transmitted infection. So this is all I have to share with you today. Thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Messimiri saying thank you. Bye and see you in our next video.